welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we are going to update you as best we can about what's going on with the Affordable Care Act and people who need health insurance, but mainly we're going to tell you how to get even more up-to-date information. My guest is Gaylene Kanoyton. Welcome, Gaylene.
Thank you for having me.
You have made it your personal mission to really inform people about this. Why is that? Tell us just a little bit about your company and what you do.
All right, so my company is Celebrate Healthcare, and we are an education and enrollment company. We go around to churches, community centers across the state, and we enroll people. We work with a trusted insurance company, navigators, and make sure that people understand what the Affordable Care Plan is and understand what benefits are afforded to them.
Because it's still, I'll be honest with you, it's still kind of confusing.
It is.
In a good year. And this maybe isn't a good year for people who rely on this health insurance. So can you tell us what the current state is of the Affordable Care Act?
Well, enrollment begins on November the 1st, and it goes to December 15th. It's only 6 weeks. And so we need people to really pay attention to this because you only have 6 weeks. You have to renew if you're
So
currently
it doesn't auto-renew?
Well, we're waiting to hear about that. I'm not giving any definitive information till I see everything in writing.
I don't want you to give people,
yes, exactly.
show up at your events and ask then, and that may or may not even be definitive.
And that's the
reason
why.
So in motion
and that's the reason
year.
why we have these events, so you can talk to someone face to face.
It makes a big difference.
Right.
I've been to one, and it really does make a difference.
And so November 1st to December 15th, you only have 6 days to enroll because on Sunday.
Oh, 6 days a week. Okay.
6 days a week. It's 6 weeks, 6 days a week, because on Sunday, the system will be down for maintenance. So everyone will have 6 days. So you have Monday through Saturday. You can go on healthcare.gov. You can also call the 800 number. You can go to localhelp.gov as well and find out where your local navigator is. But healthcare.gov is really the site where you can find everything. And I went on it this morning, and it's fairly easy. Because they ask you these questions, it's not as difficult as it was in the beginning.
It's also easy if you know things, if you know your income. But if you're in a weird transitional state, or you're working part-time, or you're ending a job, and a lot of people who need health care, it's because they're transitioning out, and you don't know if you're going to get employed or what you're going to make. I mean, those things make it even more complicated. If you're kind of have a steady income and it's the same as last year, it is pretty darn easy.
Yeah.
But are you worried that people won't register because it's so in the news, we don't know what it's going to look like in the future, and there's a lot of talk about dismantling it or, repeal whether or not there's a replace. And people, I think, are maybe losing confidence? Well,
let me just say this. With the Affordable Care, people with pre-existing conditions can get insurance. You never know what's going to happen with your health. So I encourage everyone to enroll and see what's going to happen in December. But enroll. Just go ahead and enroll.
Because it's your only chance,
It's your only chance.
Unless you have a circumstance change.
Exactly.
That's the only way you can enroll mid-year.
We have 18 million people across the country that's in the Affordable Care Plan. And 80% get government subsidies, and that's another thing that's the issue right now, too.
That's the question, too. One question is, will it be there, and will it continue to, cover pre-existing conditions? And then the other one is, how much subsidy can I get? Because I think, as you said, 80% of people get subsidies. So can I afford this if I don't get a subsidy?
And this is the reason why you need to come to our events and talk directly to an agent or to a navigator to see what's available to you. It's different for everyone. But, I have faith, and I believe that before this year's over with, some of the major issues will be resolved. I think people are working together in Washington, and I really have faith. So I'm just telling everyone, don't wait on what's going on in Washington. Just come and enroll between November 1st and December 15th.
So enrolling, there's no risk, right? If you enroll and then it goes away, you didn't lose anything. If you enroll and the circumstances change and you can't afford it, you just don't make that payment and you're not enrolled.
That's exactly right. Yeah.
So show up.
Show up and enroll. Because, it's so important. You get all your preventative care. needs through the affordable care. Women can go and get their mammograms. You can get your pap smears. Everyone can get their colonoscopies. You know, I mean, it's just so many things that you can get.
These are things that save lives and save money.
Exactly, save lives and save money. Oftentimes people use the emergency room as their care. You know, so why not just go ahead and enroll in it? Because if you go to the emergency room, it's going to cost you thousands of dollars.
And in Hampton Roads, we have higher than average incidence of diabetes, of asthma. I mean, a lot of conditions that can be manageable, but that takes regular doctor visits.
It does.
It takes work. And it's still cheaper than managing those diseases when they're out of control.
That's right.
But you know,
and you have
most people can't do it.
Colorectal cancer and the whole 9 yards. But this gives you the opportunity to have a healthier society. We may not see it right now, but you know what? We have to be good stewards of our community and of the future. You know, and so down the road, if you go to other countries, you know, they have a healthier country because they have health care for all, you know. So we're working towards that, and I truly believe that they'll come to some resolution in Washington and resolve a lot of what's going on right now. But like I said, in the meantime, enroll, come to our events.
Okay, events. Let's talk about, you have two in Hampton that are large. You probably have others at, you know, churches or community centers or individual ones. But tell us about your big events.
Okay, so the first one's going to be in Norfolk, and that's on November 1st. It's our kickoff.
Okay.
It's going to be at Norview Community Center, and that's going to be from 10 a.m. to 1 p.m. And people can come there and they can enroll, find out what's going on in terms of what's available to them, and then we'll have counselors there that can talk to them one-on-one. And then we have other resources too, workforce development. We have schools there because it's a lot of jobs available.
But we don't want to drive over to Norfolk, Gaylene.
No, we don't. We don't want to drive over there.
Hampton,
right. We want people to come to Hampton, but I just want to, in case somebody listening have relatives in Norfolk, send them there.
True.
But in Hampton on November the 4th, that Saturday, from 10 to 1, we will be at Boo Williams Sportsplex, you know, and the 9 Armstead Point, and we'll have people there to be able to assist everyone with enrolling in a healthcare plan.
And you do tend to make that a health fair, so you've got other things too. It's not like you just stand in line and wait for your turn. You are picking up information or getting your blood pressure checked. I mean, there's usually a lot of things going on that remind us of all the things we need to do to take care of
And we'll give
health.
people updates on, you know, what's going on with the affordable care and let them know what's available to them at the same time. And so we bring people in. Like, so we bring counselors in, and because you have some people that have, you know, some other conditions that need to be, mental health conditions that needs to be helped. We bring the community service board, because many people don't know that if you have an adult or a child with mental health issues, they can fall under the GAP program, and they can get their health care and they can get mental care at no charge.
That's wonderful.
And so
That's
we provide
a
that
great
information too.
Organization. Okay, so November 4th, but you have a second one in Hampton, right?
The second one in Hampton is, well, we're still getting a location for that one.
Okay.
Yeah, we're still getting a location for that. Well, let me just say this. We have the second big one. It's going to be many outside of this one, but the big one will be December 9th and 10th at the Hampton Roads Convention Center. You're talking about that one. We have some more lead up to that one.
That's like
It's going to be a gift holiday. Yeah, we try to make it fun so people can come and they can look for gifts. We'll have vendors there, and that's it. So we're looking for vendors as well, so people can shop and then they can enroll in a healthcare plan, because December 15th is the deadline. So if we do it that week, people still have time if they miss it.
It'll be on people's minds, or at least you'll put it on people's minds, and it's a good deadline reminder. And making it a fun event, so it's easier for people to come out, talk to each other, learn some stuff, do a little shopping, support those small business vendors in our community.
That's exactly right. So we'll have events, and if you visit my website, celebratehealthcare.net, you will be able to see all of our activities that we have, and also a Facebook page, Celebrate Healthcare, because we're going to be adding many more in Newport News and other areas around Suffolk and Portsmouth and all around. We'll be having more, so we'll be doing a lot of Hampton too.
And there's an email address on that website. There's a way to get in touch with you. So if someone has a question, wants to book you for their group, and, you know, outside of the regular event schedule, I'm sure you'd be willing to talk with folks.
Absolutely. I want to be able to make sure that everyone have the correct information. Don't be fearful. You know, your health is very important, because if you don't have good health, you can't do anything. You know, so oftentimes women, mothers, we always put our health on a background. But now, you can go and get your mammograms. You don't have to worry about paying for it. You have no excuse not to go to the doctor now.
Are there figures for how many people in Hampton or in this region rely on the Affordable Care Act? I mean, I've heard the national figure is gigantic, right?
Yeah, it is, and we should be close to 1 million in Virginia, and so in Hampton Roads, I think we're up to maybe 300,000 or 400,000 or somewhere around in that number. I've got to get them waiting on the figures to come out.
So quite a few people who could be listening to this rely on that right now and need up-to-date information.
They need it all the time, all the time. Healthcare.gov has a plethora of information there. My website, celebratehealthcare.net, has a lot of information as well too, and then they can always call me too.
Okay, thank you so much, Gaylene.
Thank you for having me.
And thank you for watching. I hope that as things in this rapidly changing environment, we may not quite know what's going on with healthcare, but it is important to understand your choices and your rights and what you can do. So please, if you're one of the 300,000 who relies on this in this region, come to one of these events, go to the website and learn your options. Don't tune out the news because it's complicated or it's changing or you're not sure. Get some answers. Thanks for watching.